The learning objectives are to provide communication skills to disseminate necessary information to our potential study population, which will allow incorporation of the patient into the decision-making process when obtaining informed consent for medical research. Our intent is to make obtaining informed consent a process rather than a document, thereby optimizing the experience for both the patient and the investigator. The informed consent process consists of introducing yourself and the study, reviewing the documentation, and finalizing. This video clip highlights what not to do when introducing the study. Do not introduce the study as important information needed to take better care of the patient, which may leave the patient feeling their care will be suboptimal if they decline participation. Do not allow a noisy, confusing, and rushed environment with unnecessary personnel distracting from the study information. Do not assume that the patient will accept and begin data collection prior to completion of the process. Do not make the patient feel pressured or vulnerable. Do not use unwelcoming nonverbal cues such as lack of eye contact or crossed arms when discussing participation with the patient.
Adams, we're going to get started. I'm going to check your blood pressure. My name's Melissa. I'm one of the nurses.
Hi, I'm Stefan. I'm one of the nursing students. Hello.
Very good. So what we do is we check her blood pressure, and then we're going to do some blood work.
Hello. Hi, Miss Adams. How are you? I'm Dr. Muscat. I'm one of your doctors. Nice to meet you. So I'm going to be helping to take care of you.
Okay.
And I'm coming to talk to you. You have high blood pressure, is that right?
Yeah.
Okay. And we are.
I'm just gonna put the tourniquet on, okay?
Okay.
We are
Your blood pressure is fine, by the way.
doing the study.
I don't know how
Because
to
we're
do
trying to
this.
figure out if there's something in your blood that's going to be good in terms of the medication that we plan on starting for you, and since I'm going to be helping take care of you, it's really information that I think is very important, and it's important information for your health, and it's important information I think that we need to know in order to properly take care of you. And the nurses are going to start to do some blood for you, and it's part of what we normally do, but I just want to take a little extra blood, and we'll be able to test for this
And then what you're going to do is you're just
potential
going to
protein in your blood that might kind of.
Okay, I'm just gonna wipe your arm, just like this to get some blood.
I'm sorry,
So-
what's the protein for?
So you have high blood pressure,
Yeah.
and we're gonna start you on a medication, and we
Okay.
wanna know if it's the right medication, and so we need to draw this blood to see if it's the right medication
What
for
kind of
you.
needle is this?
So does that sound like something that
A butterfly.
you would be
Yes,
willing to
just a
do?
butterfly
That you just
needle.
wanna know before the blood gets drawn.
Okay.
Okay,
Yeah.
great, perfect, so I'll go get the consent,
All right.
okay?
Thanks. Perfect. Yeah, just like
This video clip highlights what to do when introducing the study. Introduce yourself as a member of the healthcare team. Use welcoming body language and nonverbal cues, such as arms unfolded, speaking to the patient at eye level, and using eye contact. Create a quiet and unrushed environment. Explain what research is. Emphasize that participation is completely optional. Give background information on why the study question is important. Explain where the involvement deviates from standard of care. Give an overview of the experience the participant can expect. Allow the patient time to communicate and inquire about questions the patient may have.
Hello, how are you? I'm Dr. Muscat.
Nice to meet
Ms.
you.
Adams, is that right?
Yes.
Nice to meet you. I'm one of the doctors here in the hospital who helps take care of patients with different medical problems, including high blood pressure. And I wanted to come and speak to you today because I know that you've recently been told that you have high blood pressure.
Yeah.
Is that right? Okay. And your doctors want to start you on medication to help treat the blood pressure, is that correct?
Yeah, I tried diet and exercise for a while, but it's
Okay. So we do know a lot about high blood pressure in terms of it affects a lot of people, but we don't really know a lot about how different people respond to different medications and really what's the best medication to start for different people.
I was wondering how they would pick that.
Right. So we're participating in a research study, and a research study helps us to answer a question about a certain thing. So we're participating in a research study to see if there's something that may be present in the blood of patients who have high blood pressure that may make them more or less likely to respond to a certain type of medication.
Oh.
It would be completely optional, your participation. It would involve measuring different things in your blood, and those blood draws would be done at the time that you would have a routine blood draw as part of the standard of care or as part of the standard procedures that are done to help take care of you with blood pressure issues. So if it's something that you think you'd be interested in, I would like to talk to you a little bit more about the study and maybe go through what your participation would entail and what the risks and benefits would be to you. Does that sound like something you might be interested in?
Yeah, I'd like more information about it.
Okay,
This video clip highlights what not to do when reviewing the documentation. Do not ask the patient to sign the document without being alone to review and ask additional questions. Do not begin setting the patient up as if they are enrolled before the patient actually accepts enrollment, which may leave the patient feeling coerced into participation. Do not allow an uneasy and rushed setting. Do not omit finalizing the information with the patient and addressing unanswered questions.
Okay, so I have the consent form, okay? So this is everything that we just spoke about, okay? About how we're drawing your blood, we're gonna take a little extra blood, and then we're gonna be able to do different studies on it, okay?
Okay.
So I'm gonna make a copy of this for you. I just need you to sign this right now, and then we'll initial the pages later.
Perfect. Okay.
Great, perfect, okay. So when they're
Just put
finished,
pressure
I'll
right
have
there.
you take a look at it, sign the bottom of the pages,
And
and
what's
then
your
I'll make you a
name and
copy,
date of
okay?
birth
Okay.
so that the blood can go off?
Thanks. It's Tracy.
Okay, Mrs. Adams, what I'd like to do now is go through the informed consent document with you. Okay, this is written down in words what we're going to speak about today. Okay, you're going to have the opportunity to take this home with you. You'll get a copy of it. So if you have any questions later throughout the study, duration of the study, you'll have the opportunity to go back to this and have your questions answered, as well as know what the contact number is to reach me at any time. Okay, so what I'm going to do is go through every section. There's a spot at the end of each page for you to initial, just to confirm that we've gone through the information on that page and that you've had the opportunity to answer questions. And on the very last page is a space for you to sign. Okay, and when we're done, you'll get a copy of this to take home. Okay, so we'll just go through the sections. The first is the introduction. This describes to you the reason why we're doing the study, what your participation is in the study, and how many patients we anticipate that we're going to enroll. The second part kind of gives just a background.
Should I initial?
Okay. This next part specifically details the procedures that are going to be done as part of the study. And so as I described before, what it really involves is just having a little extra blood, about a teaspoon or so, drawn at the time when you would normally have blood drawn as part of the normal standard of care to take care of you, okay? Risks of a blood draw include a little discomfort at the site, maybe a little bit of bruising, very rarely infection, but we use all of the processes and procedures that we need to make sure that those risks are decreased. And the amount of blood that would be extra taken for the study is not a large amount of blood. Like I mentioned, it's just a few teaspoons, and it's blood that your body makes back within the day. Okay. This section describes the risks and potential benefits. So we just went through the risks. The benefits, there may not be any direct benefit for you for participating in the study. We're still collecting information, and so it may not be something that benefits you directly, but it may be something that will help you in the future or may help other people who have high blood pressure in kind of figuring out what's the best medication for them. Okay. And then the last few parts on the page here just describe if you have any concerns, if you'd like to withdraw from the study at any time, which is your option, the right kind of people to call and people to reach out to do so, okay? That's my name right there, and that's my number, okay? Okay. So then what I would just need you to do is sign right here, okay? And then I'm going to give you a few minutes to kind of look through the document and make sure that you don't have any other questions.
Okay.
Okay? And did anyone come with you today? Any other family members?
My husband's waiting outside.
Do you want me to have him come in so you guys can talk about the study at all?
No, I think I'm okay.
Hello again. Okay. So, did you have the chance to look through the consent form?
Yes, I read through and I signed it.
Okay. Did you have any questions about anything?
No, it's pretty straightforward, and I think you did a good job explaining everything.
Okay, wonderful. So what I'm gonna do is I'll make a copy of that, so that you'll have a copy to take home, and then I'm gonna have the nurse come in and draw your blood, okay? And then, as soon as you are done and before you leave, I'll just come in and talk to you again, just to make sure you don't have any other questions, and kind of set up your next appointment for us to discuss the results and see what else that we can do to make sure your questions are answered.
Okay, great.
Okay?
Yeah, thank you.
Perfect. So I'll just have the nurse